Hi, I'm Dr. Chad Duplantis. I'm a restorative dentist in Fort Worth, Texas.
Hi, this is Dr. Jeff Rohde in Santa Barbara.
I'm Dr. Mina Barsoom with cdocs.com.
In these unprecedented times, I'd say one of the things that's changed in our own practice is we are seeing an unprecedented amount of bruxism and clenching with our patients. It's an anxious world out there.
Our patients are facing these same problems as well. They've been dealt with a lot of financial struggles. Some of them have lost their jobs. They've been furloughed. They've taken a pay cut.
I'm sure many of you have seen this in your practices, and we've seen it as well. Patients are coming in today with a lot more occlusal wear, fractured teeth, and just signs of stress-induced bruxism, nocturnal or even during the day.
So we need not downplay our role as dental professionals in treating these problems with our patient population, and we need to educate our patients so that they understand that we do play a vital role, and them ordering a mail order night guard could be very detrimental to their overall oral health.
We want to make sure we treat them and give them a way to protect their teeth and protect their smiles.
We've been using the SprintRay Pro desktop 3D printer for almost a year now, and what it provides us is a way to fabricate night guards in-house.
Over the past several months, we incorporated a SprintRay printer into our office, and we've been fabricating night guards in-house utilizing an online design service in our SprintRay printer.
It's a much less expensive process to be able to do it in-house.
So SprintRay and Keystone have come up with a campaign called Protect a Smile.
So with this Protect a Smile campaign with SprintRay, we've been able to deliver more and more splint therapy to our patients because now we have a very efficient workflow for it.
Being able to deliver that in the same day, we're retaining a file, right? So if a patient happens to lose their guard or their dog eats it, which seems to be a weirdly common thing, all we have to do is call up that file, print them another one, and we'll get them going again.
Fabricating models, fabricating night guards is quick, it's efficient, you have complete control. I really appreciate what SprintRay and Keystone have done with this Protect a Smile campaign.
But what I'm seeing more and more is patients want things now. They want them today. And now with SprintRay and the SprintRay Pro and some of the material partners that we have, we're able to print high quality splints here in the office and deliver them very, very efficiently.
These are, I think, one of probably the most important appliances we can make these days, simply because people are cracking and breaking things as the anxiety continues. So that's why the SprintRay Pro 3D printer has been just a great adjunct to the technology we already have in delivering the best care we can for our patients.
This night guard material is fabulous. They drop right into place, and I feel that we're going to get a great return on investment for years to come. So I encourage you all to look to take control over your night guard fabrication and possibly start doing it in-house, and I don't think you'll look back. Thank you very much, and best of luck to all of you getting through this pandemic.
With the Protect a Smile campaign and the ability to deliver instant, immediate splint therapy to our patients to protect them against nocturnal stress-induced bruxism, we're able to treat our patients better and more efficiently. So hopefully you'll start considering some of these tools and technologies in your office to deliver this type of therapy to your patients, because they will appreciate it and you are helping them protect their smile. Thank you again. This is Dr. Barsoom with cdocs.com. Take care.